All right, let's focus now on COVID-19, and there's growing concern on two fronts. First, the Filipino vessel docked in Durban Harbour, quarantined after 14 crew members tested positive for the virus. The ship had sailed directly from India to Durban. Now, one of those crew members who was battling to breathe has now been hospitalised. Real worries that the variant dominant in India may create problems for us here in South Africa. And the other area of concern, that Gauteng may become the epicenter of a third wave, with rising numbers in some parts of the province. Let's discuss this now with Dr. Harry Moultrie, senior epidemiologist at the National Institute for Communicable Diseases, the NICD. Good evening, Doctor. So let's first of all talk about the concerns in Gauteng. Are there specific hotspot areas? Talk us through them.
Evening, Sally. Evening to your viewers. Yes, we are seeing a rise in the percentage testing positive in certain areas of Gauteng, specifically Sedibeng, so the Midvaal and Mfuleni sub-districts, as well as some areas in Tshwane. And with both percentage testing positive and the number of cases increasing, there is some concern in specific areas. You must bear in mind that we've also got considerable resurgences going on in the Free State, particularly in Mangaung and in other areas of the Free State, but also within the Northern Cape. But those seem to be stabilizing at the moment.
And obviously the concern here in Gauteng is because it's a densely populated province, any massive uptick in cases could precipitate our third wave. Are we close to a third wave? Any idea of timing?
There's certainly some concern. The trends at the moment are in the wrong direction. But predicting the exact onset of the third wave is difficult, and monitoring percentage testing positive admissions and deaths is our best idea of timing. The South African COVID Modelling Consortium has undertaken some modelling of the third wave. For most provinces, in fact all provinces, with the exception of Gauteng, the third wave is predicted in all scenarios to be smaller than the second. The one exception is Gauteng, where two of our scenarios, and that those scenarios are based on the speed and the extent of people's and government's responses to resurgences. In our two slowest or weakest scenarios of 5, we do see some potential for a third wave to be as big as or slightly larger than the second wave.
All right, so just to talk me through what it will boil down to, a quick reaction from monitoring surveillance teams on the ground.
And by individuals. And it's very clear in the models that the size and scale and timing of these waves is highly dependent on a combination of individual behavior. So that's our adherence to social distancing, hand sanitizing, mask wearing, avoiding large crowded indoor spaces, together with potential restrictions from nationally directed from government. It's also obviously dependent on the seroprevalence within the percentage of people who are already immune within a province. In Gauteng, our estimates are slightly lower than for some other provinces. We're also seeing slightly higher projections, partly because of the lower seroprevalence estimates, but also because of the higher concentration of adults working population with comorbidities, which could result in higher admissions within the province.
All right, so we've got an uptick in cases in hotspots in Gauteng, concerns about an uptick in cases in parts of the Free State and the Northern Cape. We have a vessel docked in Durban Harbour at the moment, 13 crew on board who have tested positive for COVID-19. One of them, the 14th, is now in hospital battling to breathe somewhere in Durban. That ship came directly from India. I want to ask you how concerned we should be if the variant dominant in India starts to spread here in South Africa. There are no indications that there are any cases at the moment. We're also told that the variant from India is actually not as mutated as the variant that is circulated here, and we might have cross immunity. So how concerned should we be about the possibility of this variant from India moving into our populations here?
So we certainly need to be alert for it and monitor the situation closely. But at the moment, there's no reason for alarm. Many of the mutations in the B1617 variant, which is one of the variants circulating in India, interestingly, our variant, the B1351, is also quite prevalent in India. But they share a number of mutations in common, and there's not a strong evidence at the moment that should and when the B671 Indian variant get introduced to South Africa, that would necessarily outcompete our variant. So we need to be alert, but it's not a reason for alarm. I've noticed the news reports by anonymous Ministerial Advisory Committee members sounding the alarm. I think that's a little bit early, and I don't think we have a reason for panic yet. We continue to watch the situation and monitor the situation closely, and I have confidence in our ability to identify the variant and to respond appropriately.
Ordinary South Africans are saying, you know, we should ban any flights and any travellers from India now before it potentially gets out of control. Is that an overreaction, or do you think that's perhaps a wise precaution we should be considering?
These variants will spread potentially around the world, and it won't just be from India, you know, that this variant is found. In fact, I think it's already been found in a number of other countries. The potential economic costs for shutting down travellers from specific countries, in the absence of clear evidence that the B1617, that's the Indian variant, is any more transmissible or any more severe or results in greater immune escape than our own variant, I think would be inappropriate at this point.
All right. Well, thank you very much, Dr. Harry Moultrie, Senior Epidemiologist at the National Institute for Communicable Diseases.